Hello, my name is Alan, and I'm an occupational therapy student at Beaufort Memorial Hospital. This is the shoulder replacement class, and here I will talk to you about things you can do to prepare for your surgery, what you can expect while you're at the hospital, and things you need to accomplish in order to be discharged home safely. At Beaufort Memorial, we have a wellness model program because you guys aren't sick patients, you are well patients in need of a shoulder replacement. You'll be able to designate a first mate, and that can be a spouse, family member, relative, neighbor, someone that can support you throughout the process. We have a dedicated joint replacement unit with specially trained staff. We want you to have a short, pleasant hospital stay. And one of the first people you'll see after your surgery are the occupational therapists to help begin your rehabilitation journey. Whenever you have a surgery, there are some risks that are involved that include things like blood clots or infections, which we'll talk about over the next few slides. Nerve, vessel, ligament injuries are possible, poor wound healing, limited range of motion in your new shoulder joint, hematoma, or instability and loosening in your shoulder. Some signs and symptoms of DVTs or blood clots that you need to be aware of are pain and swelling in the limb that is not relieved with elevation above the heart, reddish skin color, or skin that is warm to the touch. If you notice any of these signs or symptoms, call your medical doctor. A pulmonary embolism is a blood clot that has moved to the lungs. This could look like shortness of breath, chest pain, lung or rib pain, coughing up blood, rapid heartbeat, and feeling faint. If you notice any of these signs or symptoms, call 911 immediately. Some things that we do to help prevent blood clots include having you mobile soon after your surgery. You'll also be wearing foot pumps or calf pumps that inflate and deflate using air to move blood throughout your body. Some things that you can do to reduce the risk of surgical site infection include avoid shaving underneath your arm for 48 hours prior to surgery, eat nutritiously, control your blood sugar, stop all tobacco or nicotine use, make your surgeon aware if you have any other infections. Any dental care work should be completed at least 3 weeks prior to your surgery and avoided 3 months after your surgery. And of course, make sure you clean your hands and perform frequent hand washing. Five days prior to your surgery, including the day of surgery, you'll need to perform a Hibiclens shower from the neck down. Hibiclens is just an antibacterial cleanser. If you're MRSA positive, you will also perform the Hibiclens shower and apply a special ointment to your nose and nails 5 days prior to surgery. In order to reduce the risk of infection, avoid sleeping with pets during the shower regimen or during the healing process. At Beaufort, we have a blood conservation program to help reduce your risk of blood transfusion. In order to do that, we screen you for anemia during your pre-op visit, and if you are in need of the blood conservation program, we'll then notify you. Transfusion rates for joint surgeries are very low, but for more information on blood conservation program, you can contact Mary Ann Taylor. Some things that you can do to help prepare for your surgery include watching a pre-op YouTube video or attending an in-person class, complete the nurse liaison interview, all the lab work, and all the tests, identify your first mate or coach, and stop taking medications that thin your blood as instructed by your nurse or doctor. Your balance and endurance won't be 100% after surgery, So some things you can do around the home to prepare are make sure all areas have adequate lighting. Make sure your stairs are free of debris and you have adequate handrails. You can move furniture around your home to make clear walking paths. Things that may be stored down low in the bathroom or in the kitchen can be placed on the counter to help reduce falls. You won't be able to drive for 4 to 6 weeks after your surgery, but make sure any vehicles that you may be using you can get in and out of safely. Some things that you can bring with you to the hospital include your Joint Connection Resource Guide, footwear that you can easily slip on, 2 changes of comfortable, loose-fitting clothes, your CPAP or BiPAP if you currently use one, and you will be called the business afternoon prior to the day of your surgery to inform you of your arrival time. The day of your surgery, you will arrive at entrance number 4, that is the surgery pavilion and birthing center. There you can check in at the surgery lobby desk. You'll then be prepped for surgery with an antiseptic skin wipe down along with the nose and mouth treatment. They'll also start your IV, and any hair that needs to be clipped will be taken care of there too. You'll then be taken to the holding area where you will meet your anesthesiologist and they will mark the operative site. There are different types of shoulder replacement surgeries that you may have. There's an anatomic shoulder replacement and a reverse shoulder replacement. You can talk to your medical doctor about the surgeries and which one he will perform. While you are in surgery, your family and friends can wait for you in the surgical lobby, and if they choose not to wait there, they can leave a phone number which they can be contacted at. Then you will be moved to the PACU or recovery room, and once there, you'll have constant care from a registered nurse. Things may seem bright and busy because you're just waking up from anesthesia. You'll have several monitors and oxygen on, and your arm sling will be in place. While you're in the recovery room or PACU, visitors are not allowed. Your surgeon will contact your family about your progress, and the surgeon will let your family and friends know when they can go to the Joint Replacement Center and wait for you there. After surgery, there are several different equipment that you may have on. That includes things like your IV, cold therapy, which are ice packs, the foot pumps or calf pumps. You could have a tube in your nose that supplies oxygen, a blood pressure cuff, heart monitor, and your arm sling. After surgery, it is important that we manage your pain because once your pain gets too high, it'll be harder to bring it back down. So don't hesitate to ask your nurse for pain medication. Let your nurse know what has worked in the past and what hasn't worked. It also wants to help prevent nausea. If you feel nauseous, you can let your nurse know and she can give you medication for that. Pain medication also can cause constipation, so drink plenty of fluid and eat high fiber foods. The day of your surgery, you could be offered the flu if it's flu season, the flu vaccine, and pneumonia vaccine. You'll have a team that will also monitor your vital signs, your bandage, your coughing and your breathing. You may have a spirometer that measures your breathing. Your team will also monitor your pain, your diet. You'll be moving around with nursing and occupational therapy. And once all these goals are met, it's possible you may go home that evening. So post-op day 1, your safety is going to be our primary concern. An occupational therapist will perform an evaluation to assess your ability to do tasks safely. Nurses will provide pain, nausea, and drain management. Occupational therapy looks at your ability to do self-care tasks. We focus on ADLs, or activities of daily living. This includes things like showering, bathing, dressing, grooming, toileting. We'll teach you new strategies and techniques to get in and out of the shower, to dress with your shoulder sling, and we'll show you how to properly adjust and don and doff your new sling. To prepare to return home, talk to your family and friends to determine what type of help you will have from them. Do you have someone at home to help assist you? You will not be permitted to drive for 4 to 6 weeks after surgery, so plan for someone to drive you home and to future doctor's appointments. If you need a temporary handicap parking permit, contact the surgeon's office in advance of your operation. After your discharge, care coordination will help arrange equipment and follow-up services and appointments. This is a discharge checklist for you and your first mate. The first is incision care. You'll need to keep your incision clean and dry. Also, watch for signs and symptoms of infection. That includes things like redness, pain, a prolonged high fever, or a change in drainage. If you notice any of these signs or symptoms, call your doctor right away with problems. Be aware of prevention of blood clots, the pulmonary embolisms, signs and symptoms of DVTs or blood clots. Your occupational therapist will show you how to properly manage your sling and control discomfort. You can use pain medication and ice packs. Your joint connection resource contains important phone numbers, email addresses, and websites, so keep hold of that book. The total joint coordinator, her name is Andrea Sadler. Her cell phone number is there on the screen. You can contact her with any questions that you may have. Now I'm going to show you how to properly don and doff some different types of slings. In this video, I'm going to show you how to use the different types of slings that you'll have after your surgery. When you get back from your surgery, your arm may be numb and you won't be able to actively move your arm. However, you will be able to use your non-surgical arm to manipulate your surgical arm. You can do that by grasping underneath your wrist and lifting your arm away from your body. Each sling may have an abductor pillow. The curved part of the pillow will go against your side, and the strap goes around your body. The first type of sling is the mini kahuna sling. This sling has one strap to don and doff the sling. When you put this sling on, you'll take your non-surgical arm and lift under your wrist and lift your arm up and into the sling. Whenever your arm is in the sling, you want your elbow close to the back. And the strap goes over your shoulder and connects for a... Now once the sling is on, we can adjust
mini kahuna sling folds backwards. Now your hand will be numb when you come from surgery, but you will be able to move your fingers, your wrist joint, and your elbow. So you can fold this part back and it velcros to itself to allow you to use your hand. There's also a ball that goes in the velcros onto the mini kahuna, and that's to prevent atrophy and help increase circulation. This sling also has a thumb strap that goes on one side of the sling across your thumb and connects onto the other side to prevent your hand from falling out of the sling. Has a strap over the top to help secure your arm in place. And whenever your arm is in any sling, you want your arm parallel with the ground. In order to adjust the arm height on this sling, has a strap in the front. You can pull it to raise your arm up higher and velcro it on itself to secure the sling. In order to take this sling off or to doff this sling, there's a clip right here. So you want to make sure your arm is supported and doesn't just fall. It can be supported in your lap. You'll unclip the abductor pillow strap. Unclip the strap across. Use your good arm to remove your arm from the sling. You can rest your arm in your lap. This is a different type of sling that you may have after your shoulder surgery. This one's called the Bragg Slingshot 2. This sling can also have the abductor pillow, but it works the same as it does with the first sling. This sling has one strap that goes across the shoulder with a comfort pad. To put this sling on, just unclip the hook. Again, you can't use your arm with your shoulder muscles, but you can use your good hand to lift your arm and place it into the sling. Once your arm is in the sling, take the strap across your other shoulder, and it clips. This comfort strap is adjustable by Velcro, so you can remove some Velcro and adjust it and find a comfortable position on your neck. Again, whenever your arm is in the sling, you want your arm to be parallel with the ground. This sling adjusts with a strap that velcros onto itself. The Slingshot 2 also has a thumb strap to keep your arm from falling out the front. That velcros onto the side, across your thumb, velcros onto the back. And this sling also has a strap to go across the top to more securely hold your arm in the sling. In order to doff this sling, you remove the thumb strap and the other strap. Unclick the buckle. And use your non-surgical arm to remove your surgical arm from the sling. This sling is called the Bragg Atlas. You may also have an abductor pillow with this sling. This sling is unique because it has a shoulder harness. I'll show you guys how to don and off this sling using the shoulder harness. To place your arm in a sling, again, use your non-surgical hand to lift your arm and place it into the sling. This sling has two rings, one in the front and one in the back. It also has two straps that create the shoulder harness. Take the longer strap. And go over the top of the shoulder. Just Velcros into the front circle and into the back one. And it Velcros onto itself. The second strap Velcros onto itself through the front circle. It goes underneath the arm. And it Velcros into the back circle. And to tighten or loosen these straps, you just undo the Velcro and pull to tighten, or you can give it some slack to let it loosen. And once this sling is properly put together, you don't have to remove the straps to undo the shoulder harness. It has one clip right here in the front that you can use to doff the sling. Okay. And you would slide your arm out. There's also a couple other things I need to show you about this sling. You're able to adjust the length of the sling by rolling the front backwards to shorten the length. You can roll it forward to extend the length, but you want it in a place where it can support your hand, but you're still able to use your fingers. The sling has one more adjustment. On the elbow, there's a piece of Velcro you can use to better secure the elbow in the sling. And it just secures and Velcros onto itself. Right. So that's the Brig Atlas sling.